Landmark UN meeting calls for disease prevention to preserve both health and economies. In its second session ever to address human health, the United Nations General Assembly meeting opened this week with a two-day forum on halting the impact of non-communicable diseases, or NCDs.
This meeting must be a wake-up call for governments at their highest level. This must be a watershed event with a clear before and after. With ignorance, complacency, and inertia replaced by awareness, shock, and the right actions right away.
With keynote speakers that included UN World Health Organization Director General Margaret Chan, UN Special Rapporteur on the Right to Food Olivier de Schutter, World Economic Forum Senior Director of Health Olivier Reynaud, and Anne Keeling, President of the NCD Alliance, a coalition of about 2,000 health organizations worldwide. Participants addressed issues surrounding leading NCDs, such as cancer, type 2 diabetes, and heart and respiratory disease. Although these illnesses are now known to be almost entirely preventable through changes in diet and lifestyle, the UN World Health Organization, or WHO, noted that in 2008, some 36 million fatalities, representing more than 60% of the deaths worldwide, were due to NCDs.
Our meeting today awakens us to the reality that NCDs have now surpassed HIV and AIDS as the leading cause of death worldwide.
Also released was a study conducted by the World Economic Forum and the US-based Harvard School of Public Health, the first to document adverse economic effects of non-communicable diseases, which stated that they could cost the global economy $47 trillion within 20 years. At the same time, the study concluded that NCDs could be curbed at very little expense by working to eliminate the main risk factors of alcohol, tobacco, unhealthy foods, and sedentary lifestyles. At the meeting's conclusion, a pledge was made by the UN world leaders toward comprehensive preventive action, with a declaration that stated, non-communicable diseases can be prevented and their impacts reduced, with millions of lives saved and untold suffering avoided. Proposed measures included higher taxation of harmful alcohol and tobacco, along with policies to support healthier diets, such as agricultural subsidies that improve access to wholesome food, like fruits and vegetables.
We should encourage individuals to make the smart choices that will protect their health. I refer not only to food manufacturers, but also the media, marketing, and advertising companies that play central roles in these enterprises.
Since the first health issue of HIV/AIDS was addressed a decade ago by the United Nations, there has been significant progress on preventing and treating the virus. The body's hope is that non-communicable diseases will see the same advancements.
We've shown that when the nations of the world come together, we can achieve great improvements in health.
Many thanks, United Nations, World Health Organization, and all other participants and contributors for your commitment to eliminating these devastating but preventable diseases. May leaders everywhere work to implement measures that restore vibrant health and well-being to fellow citizens across the globe.